my interest in all of this really came when I turned about 40, and I felt like somebody just did this to me and pulled the rug out from under me. Does that sound familiar to anybody here? But what I'm here to talk to you about tonight are the areas that I've highlighted in yellow. So the first thing that I want to talk about is incontinence, and I'm here to tell you that it is a common problem. In fact, 1 in 3 women have an issue with stress incontinence, which is coughing, laughing, sneezing, and leaking. There are basically 4 main categories of urinary incontinence. There's 2 that are most common. So over here, there's the coughing, laughing, sneezing, can't jump on the trampoline, can't work out, have to wear black pants when I go to the gym, that type of thing. And then there's the urgency, frequency. I always need to know where the bathroom is. I go to the bathroom every chance I get. I wake up in the middle of the night. When I have to go now. And that's called urge incontinence or urge issues. Over the last 15 years, the treatment of stress urinary incontinence has just gotten easier and easier. And nowadays, how I treat 99% of stress incontinence is with a simple outpatient procedure with a tiny 1 centimeter incision just in the vagina, and basically put this, it's called a sling, right underneath the bladder, and right underneath the urethra, and it supports the urethra. For women who have either tried a medication and it hasn't worked, or women who are just intolerant of medications, nowadays there are other options. The woman on the right, and what that is it's essentially a acupuncture size needle that goes into the leg and stimulates the tibial nerve, and then the impulse travels up to the pelvis, and then basically it's just telling the nerves of the pelvis to slow down, stop sending this message back to my brain and spinal cord to tell me that I have to go to the bathroom. Okay, I'm going to switch gears again and talk about another symptom or another problem that's common as women get older, and that's pelvic organ prolapse. So the symptoms that women usually present with this are, I feel like something's hanging down, I feel a bulge there, I'm having pain with intercourse, and essentially what pelvic organ prolapse is it's not really a problem with the bladder or the rectum, but it's this area in here called the connective tissue that has weakened and has allowed the bladder or the rectum to bulge into the vagina and either come down lower than it should or even come out of the body. So what we do to fix it, essentially, we basically reinforce the area of defect with a piece of mesh that lies in between the bladder and the vagina and then the posterior wall. And then we basically pull it up and attach it to the sacrum to basically just give some traction and pull it up back to where it is supposed to be. This is all done in the hospital, obviously, using an instrument called the robot or the Da Vinci robotic system. And it's all done through 4 little incisions in the abdomen